Hello everyone, and thanks for taking the time to check out this video. This is an update video to my ICL series. It is currently about 1 month, 3 weeks after my original surgery and about 1 month after my repositioning surgery. If you would like to know more about those events, check out my playlist in the video description below. So, I did have the repositioning surgery. The surgery was about 3 minutes long, I'm guessing, and it was just to rotate that lens in my left eye by 15 degrees. It was a very easy surgery. The prep and recovery was the same as the original, except it was an even simpler procedure. I wanted to wait some time after that repositioning before making this video just to make sure everything was in the clear. So I just wanted to wait a while to provide this update. After the reposition surgery, I had my 1 month post-op check. That was 1 month after the original surgery. And at that check, I already knew I was seeing very well, but I wanted to see what the official results were on the vision test. And I was seeing, I could easily read the 2016 line with each eye, and I could actually read about 4 out of 5 letters on the 2012 line, so that is like a miracle to me. I haven't had any pain, I have no dry eye, no severe symptoms at all really, but just to talk a little bit about what you could say are problems is, after each surgery, I had a dull ache in my left eye for about 5 days after the surgery. It wasn't anything bad. Over-the-counter medicine was fine to treat it, or I could just ignore it most of the time. And that was after each surgery with my left eye only. My right eye never had any problem. It was perfect the whole way. I do see some halos in low light. What that is just a ring of light around any light source, and the light has to be pretty dim for me to see those halos. It's not debilitating or anything like that. I know some people that have a refractive surgery really can't function at all at night. Most apparent place I see that is driving at night, and the first time I did night driving, it was a little bit scary. Because I'm just seeing extra light, that's not really there, so it just took a little mental energy to filter that stuff out. But I didn't have any problem. I could see well and everything. And at this point, I'm getting pretty used to it. It's like my brain's adjusting and already kind of filtering that stuff out automatically. So yes, I do still see the halos, but it's not a problem. So those halos at night are my biggest downside. It's certainly not anything dramatic, and the reality is any method you use to correct myopia is going to have some kind of drawback, and this is definitely better than glasses or contacts. So my next checkup at the eye clinic will be a 3-month post-op check, and at that check they're going to dilate my eyes and look at my retinas just to make sure everything's healthy, and I'll be back to provide an update after that. And I also plan to do a short video about things that are different after ICL. I mean, besides the apparent clearer vision, there's just, some little differences that I noticed that might be interesting to you. So check back, and thanks for watching. Bye.